So some of our Incredible Fathers listeners have actually suffered from PTSD. What counsel or advice would you have for them with your professional experience?
That gets a little bit complex because that can come with some other just depending on the individual's expression of that PTSD. Like someone who is struggling with PTSD may display stronger symptoms of depression, depending on, or they may display stronger symptoms of anxiety, depending on as it relates to their trauma. So when you look through the symptoms of PTSD, one of the behavioral responses to trauma is avoidance. um, some of the other behavioral responses to PTSD are having continual thoughts about it, particularly in their dreams. The traditional symptom of PTSD is whenever you experience samples of that in daily life, it causes your mind and your body to go back to react to the environment based off of just like you were there. The classic example is a soldier comes from home and they've experienced war away from home, and then they hear the firecrackers pop off and they're reacting to the environment almost as though they've heard gunshots, even though there are no gunshots. The fireworks don't sound like gunshots, but that fireworks reminds them of gunshots, so it automatically forces them into fight or flight, essentially. So how you address PTSD, it just depends on what the displayed symptoms are. I think there might be an assumption that just because somebody has PTSD, they display all the symptoms of PTSD. Nobody
Right.
experiences.
Yeah.
It is true that you can't experience all the symptoms of a technical diagnosis, but usually what happens is people experience some of the symptoms of the diagnosis enough to create a conclusion that this is the diagnosis they're dealing with, and then as therapists or helpers, we try to help them problem solve those symptoms. And that goes into a whole nother conversation about the importance of not getting too caught up in the label of something, but being more caught up in the symptoms and the treatment based off of those symptoms. Is it important to solve trauma per se, or to try to get a person to a point where they don't experience any traumatic symptoms? That's not the goal. The goal really in therapy is not to get rid of the PTSD label or get rid of the symptoms related to the label of PTSD in particular. The goal is to help the individual have enough framework, have enough coping tools in their tool bag, have enough disciplined approach with regards to those how they practice those tools or coping mechanisms, enough to be able to successfully coexist with it so that the symptoms feel smaller because their discipline and coping tools that they've used in their perspective is larger than the issue that they're dealing with.